Esophageal cancer or carcinoma esophagus. This is one of the most dreaded diseases of the esophageal cancer is one of the most dreaded cancers of the gastrointestinal system. As the name suggests, this refers to a cancer which forms the foot pipe or the esophagus. The foot pipe extends from the neck to the upper part of the abdomen. The foot pipe is the first point of contact of all the foods and toxins which we intake, and thereby it always remains at a higher risk of developing malignancy. What are the symptoms of esophageal cancer? Esophageal cancer generally happens on the inner lining of the foot pipe, and one of the initial symptoms it can cause is because of the growth, the foot pipe can get narrowed. So majority of patients with esophageal cancer present with what is called as dysphagia, or in simple terms, difficulty in swallowing. This can either be a feeling of a block when they eat or drink something, or it can just be a feeling of something sticking in the throat or in the chest after they eat. That is the initial symptom. When the tumor grows in size, it can cause future symptoms like pain. It can erode into the nearby structures like the windpipe and cause much serious complications later. How do we diagnose esophageal cancer? The most straightforward way of diagnosing esophageal cancer is with an endoscope. An endoscope is a tube with a fiber optic cable which is passed into the foot pipe, and it can diagnose with accuracy the presence of a growth or a tumor in the foot pipe. And during the endoscopy, small bits of tissue are taken to further categorize the type of cancer. To further stage the cancer, a CT scan and a PET scan may be needed. What are the treatment modalities for esophageal cancer? Esophageal cancer is best treated by a multimodality approach, meaning you do not depend on only one type of treatment. Namely, you don't depend only on surgery or chemotherapy or radiotherapy. All the three arms of cancer treatment are used in the treatment of esophageal cancer. Majority of patients these days are initially treated with a combination of chemotherapy and radiotherapy, where the tumor is shrunk, where the tumor cells which are already in the blood circulation are controlled, and then they are subjected to a surgical resection whereby the damaged foot pipe is removed and an artificial foot pipe is created by making a tube out of the stomach, and it is joined to the neck. In the recent time, this operation is performed by means of a keyhole surgery, meaning the first stage of operation is performed in the chest where the foot pipe is completely immobilized through three keyholes, and the second stage is done in the abdomen with three keyholes where the stomach is made into a tube, and later the joint between the foot pipe and the stomach is made in the neck. The advantage of this procedure is the recovery time is much faster. The complication rates, especially like lung complications, are much lesser than a traditional operation, and the patient can go home usually 4 to 5 days after the operation.